Hi, my name is Liz Turner. I'm a number cruncher. I'm an associate professor of biostatistics and global health at Duke University. I'm also the director of the research, design and analysis core of the Duke Global Health Institute. Now, we're a 10-member team of statisticians, epidemiologists, social psychologists, data architects, and we focus quite often on the evaluation of global health interventions, and often we use large-scale implementation trial design. So this brings me to a story related to really providing the motivation for my leadership project entitled Improving Health Impact, Building in the Gender Lens. So a story. In Nepal several years ago, together with partners, we were interested in evaluating a 5-session group-based intervention named Group Problem Management Plus. Now, in this context in Nepal, this intervention was to be delivered separately for males and females. And we started out before the study with a question as to whether or not we could really identify and quantify differences in intervention effectiveness for males and females. Now, you may be very surprised to learn that there are actually very limited methods available to really tackle the questions we wanted to address here. Moreover, our question around differences in this context for males and females fits very well within a broader call for disaggregation of data, and in this instance, sex-disaggregated data from the 2021 Global Health 50/50 report. So their call was for sex disaggregation should be ubiquitous within health programs. And the reason being, it's a means to hold organizations to account for their commitments, not only to equity, but also to the delivery of effective interventions. This is where we fit in. So the what of my leadership project. So we ultimately want to provide evidence to enable effective interventions to be delivered to those who need them. We want to initially identify, develop methods to design trials to evaluate differences in intervention effects by gender and indeed by other identities or other characteristics, and which are relevant to a specific context. We're going to make those methods accessible and then enable them and ensure that these robust methods for disaggregation of effectiveness of interventions are used to inform policy around which interventions work and for whom. So the how, I'm going to focus on those first two pieces of that pathway. So we have reviewed the methodological literature. We've applied the methods we've identified to existing studies, consulted with partners about how to make those methods accessible, and we're working on demystifying those methods for future use. So in terms of outcomes, we have a manuscript in development and are working on partnerships. That manuscript, bringing the gender lens to global health trials, best practices for design. And in partnerships, our goal is to partner with our collaborators and funders to design and implement future trials with a gender lens or with a lens of whatever identity or characteristic is relevant to a given context. So how does this leadership project, my leadership project, fit with the leadership journey? So here we see those 4 phases on this pathway. Well, there are 4 pillars of the leadership journey. The first pillar, authenticity, maps very well to this identifying, developing appropriate methods to design trials to evaluate these differences in intervention effects by gender. So the first pillar, authenticity, making those methods accessible, maps very well to the second pillar of inclusivity. Using those methods and facilitating disaggregation of effectiveness of interventions. This is very much related then to strategy and strategic thinking. And ultimately getting effective interventions to those who need them, that's about impact. And the 4th pillar of the journey is impactful leadership. So in closing, through my future leadership journey, the goal is on impact. I'll continue to partner with the WomenLift community, this very multi-sectoral community that really gives a huge and vast range of different perspectives on the work that I do. I will focus on building the next generation of number cruncher leaders and really to focus on bigger and bolder goals, all in the service of impact. So thank you to my cohort and thank you to WomenLift Health.